morning, morning, morning. Good morning. Good morning to you.
We are going to put our fingers on the pulse of things this morning. Well, rather the pulse at the Queen Elizabeth Hospital. And we have joining us this morning to discuss the Pulse Radio Show as well as developments at our hospital, Miss Dr. the Most Honorable Corey Forde, who is the Director of Clinical and Diagnostic Services at QEH, and Communication Specialist there at QEH, Shane Seeley. Good morning to you, gentlemen, and welcome.
Good morning.
Now, Pulse. We are into a new calendar year. You would have had your show last year, but what's going to be different coming from Pulse this year? And I'll just throw to Shane first to tell me a bit about the show and how Better Health is going to start with me, with you, with everybody.
Yeah, well, we're focusing on the new strategy for the Queen Elizabeth Hospital in the last season of the Pulse Radio Show. And the new strategy covers 2025 to 2028. And you would have heard our CEO and several of our directors, including Dr. Forde, come and share their bit of what they'll be doing in their directorate as far as that new strategy is concerned. This year, the CEO wants to focus more on action, so we are in that mode. So we will be telling the public what we are enacting as far as the strategy is concerned. There's certain components, some are short-term, some are medium-term, some are long-term, and as they happen, we will share with you on the Pulse Radio Show. But again, we've been getting calls to restart the program, so we fed into that public demand right here, back with CBC as usual on Q100.7 FM. We restart on Monday at 11 a.m., this Monday coming. And it's fitting because we're in the season of love. We're not wearing red by accident either. Yes, Valentine's is next Friday, but also we're going red in support of the Heart and Stroke Foundation's Go Red Day. So it's all about those partnerships that we'll be fostering and sharing the message right there on the Pulse Radio Show, but also to address some of the concerns. We always have been saying from the beginning of the show, we want to hear your complaints. The only way we can improve what we do at the hospital is if we hear your complaints, investigate these situations and address them, so someone else in a similar situation would not have to suffer the same fate as that individual who did in the first instance. Okay. So we want to make those corrections. We want to hear those complaints. And we don't want people to take those complaints on air without leaving their identity so that we can follow up. That has been happening. So we want to respond to that, and not only respond to that, continue to get that feedback from the public so that we can do better. We had the public feeding into the 2025 to the 2028 strategy with our public town hall at the end of last year. That was very successful. One of the things they wanted was parking spaces at the hospital. So that is something that will happen in the medium to long term. It's something that is now fed into the strategy. And Barbadians will soon get an opportunity to see that strategy in its fullness. Well, let's on the website.
Turn now to Dr. the Most Honorable Corey Forde to find out how that strategy is going to be altered in terms of the delivery of the clinical and diagnostic services.
Well, yes, pleasure to be here. Nice to see you again. Good morning to all Barbadians. And, as was said by Shane, this year is about action. And the action is starting. One of the reasons why I'm here is because for some time, the accident emergency department, for example, if you came in and you had a stroke, you had to get a CT, you had to go upstairs to get a CT. Come February, I'm not going to give you the exact date, but I know it's
happening this month.
It's happening this month.
Okay.
Come February now, what would be expected is that we will have CT services in the emergency department and X-ray services. They're already up and they're live and ready to go. We're going to go through right now a training process with the staff in the radiology department. So what does that mean for the average Barbadian if you came in, for example, with a stroke, turnaround times in terms of getting your CTs, if you need X-rays, etc., it's going to be there. in
What-
A&E on the spot turnaround
What
time.
John Public would want to know is, in terms of being able to get this scan as soon as it's recognized that the person had that particular kind of complication, how will that aid in not only delivery of the care, but in terms of recovery?
This is very important as a country. I think we are riddled by diabetes and hypertension, and then obviously an aging and the complications of that. Certainly, or things like strokes, for example. So there are protocols which are built into the emergency department for people who come in with strokes, etc. What this is going to do is to make the process faster in getting the imaging, but more than that, it allows for the appropriate action to try to reduce the sort of complications or the outcomes of strokes. For example, people with limb weakness and etc. allows you to act on that quickly. And some of this, for most occasions, we act quickly. It may be reversible, but the average Barbadian needs to know as the symptoms onset, you need to find your way for medical care. Don't wait till the next day to come to the emergency department. For example, if you have a stroke, you try to find your way there. What it does is reduces all those complications that one would see, the weakness, etc., and allows for people to continue their normal life even after. But if I may,
Sure, go ahead.
I'm thinking, I remember something happened yesterday, which I would mention. There was a patient who turned up at pharmacy, for example. I'm going to connect the dots quickly, and with a whole bag of medications to return. Some expired, some near expiration. And that speaks a little bit to why I want to encourage the average Barbadian not to do this morning. We know people will have hypertension, we know people will have diabetes, and your goodly doctor might place you on medications, and you might decide, I want to change this, I don't like this. If you have any of those challenges, speak to the doctor first. When we have cases of people returning large amounts of medication, but it comes at an expense. These medications which were returned, which were expired, are extremely expensive. And I know in Barbados, we're kind of lucky that we have, quote unquote, free medication. I think we need to look out and understand what's going on globally in terms of medications, which is also one of my other divisions in pharmacy. It is difficult now in the global stages in terms of getting some of these medications in. So if we're wasting them in Ireland, or we just let them expire, you're sitting down and they're not taking it home, it leads to you ending up in the emergency department, having to wait, having to go through processes, putting your family under pressure, putting grandma under pressure, putting grandfather under pressure, putting the kids under pressure because of now having to be hospitalized. So I think it's a wind-down process. I really want to encourage Barbadians to really take good care and a good state in terms of health and health prevention and taking the medications as you're supposed to. If you have complications, speak to your friendly doctor.
We may not always see him as friendly. Just being naughty. Now, you spoke to Annie, and it's no secret that people complain about the wait times all the time, Shane. I know there have been various strategies used, the triaging, the whole heap of it, to keep things moving. But what's the latest in terms of your surges? Are they fully under control?
Yeah, we sent out a surge notice last week to just alert the public. You have options. It's not about telling people not to come to the Queen Elizabeth Hospital's Accident and Emergency Department. It's letting them know that if you're not that serious and you come and we see you're not that serious, you will have to wait until those other emergency cases are filtered through. We had gunshot wounds coming in. We had other trauma cases coming in. And I'll let Dr. Forde speak about this situation. We've had a tide of people coming in, not taking their medication and not following, as Dr. Forde said, their goodly doctor's advice, and then following on from the Christmas season, some bad behavior in terms of their eating and drinking practices. Well, it's leading more than the usual number of people to seek medical attention at the accident and emergency department.
And I think that must be concerning for you, Dr. Forde.
Oh, for sure. In fact, I remember sitting right in this exact spot, I think in December, and speaking to Barbadians and saying, okay, enjoy your Christmas.
Not to overindulge.
Exactly. And exactly what I told them to do, they probably did it. So a lot of the challenges I know that cases are coming in are people with strokes and heart attacks and heart failure. And I'm almost positive This is really filing off of Christmas activity, people not taking the medications, having too much fun. And I just want to encourage Barbadians to take, yes.
Do they stop taking it because they're afraid of how it will interact with the alcohol over the Christmas season?
Sometimes you hear that, but I think it's our jobs as physicians to educate people about that as well. But I think more importantly, you hear me say this every single time I'm on here, is Barbadians need to understand healthcare is about not me as a doctor, it's about you taking responsibility for your health. And I think if we focus more on our own health, whether it be at work, whether it be at home, whatever we do, and understanding that healthcare is not the government, healthcare is not the doctor, healthcare is not the nurse, healthcare is not the hospital, healthcare is not any. Healthcare is you taking responsibility when you get ill. For example, if you even have respiratory illness, which is going on now, everybody knows somebody who has probably influenza or some viral illness. Seek medical care. Don't wait till you get too ill and then you have to rush you to the emergency department. If you know grandma or grandfather is at home and they're having respiratory symptoms and everybody in the house was sick and they're not looking so well, don't keep them at home until you think, oh my God, I need to get them to the hospital. Get them to the doctor very early, because again, those are some of the cases that we also see coming in. The infectious disease building, thank God for having that, is very busy. At this point, I don't think I remember the last time that we've been that busy consistently. So I think
Has it meant extra staffing?
Yeah, we had to juggle staffing within the hospital. This is part of our own internal surge plan, for these sort of events, and it's not easy. So it also puts a bit of a stress on the staff. I think people need to also understand that as well. People often think, okay, we have to provide care, but it also means the staff now has to probably work extra hours, to hold things together within the country. And certainly we've been through this in other events, which I'm going to mention in the distant past before. But I also want to mention something about blood bank, if I may.
Yeah.
With the amount of traumatic injuries, whether it be from road traffic accidents or gunshot wounds, encourage Barbadians to take heed for that. Just chill. Just chill, just being straightforward, just chill, talk to each other and deal with things differently, because it also puts pressure in the system. People, gunshot wounds come in, you have to have surgery, you might have to have blood. You want to encourage Barbadians to really, call if you're not sure, go and donate blood, and let's make sure that if we have injuries or accidents, stuff, that we have these things in place. People are often shy to do these things, but you can find out other things when you donate blood. We test for many things. It may be able to treat you for something that you didn't even know that you had. And I think that those things are important. I want to encourage Barbadians to do that. Donating blood could mean saving a life. It means saving a life for yourself. It could mean saving a life for a family. It could mean saving a life for a kid out there who has some hematological disease or blood disease. And that is important.
A lot of people might say they can't give because, they're calling for a positive today, and I'm not sure if that's what I am, and
Well, there's a donor. What's his word? A donor bank, a donor list. So it might not need you today, but we might need you next week. So if you're not sure, call. Make an appointment. You come in and you can have donate blood, and they'll have your contact. So we always have to have people be wary of that.
We're getting a little tight on our time, but I understand, Shane, that your ophthalmology department is also seeing some major changes at A&E, and you're looking to put the public more in connection with the show, not just through the show, but also through some publications?
Yes. So the ophthalmology department, from next week, that will be located at B2. Our team has been reaching out to members of the public who may have appointments and letting them know if there are any changes. And if there are any changes, there's a number that they can call. But I will always tell people to call 536-4800, which is our patient advice and liaison service, 536-4800. It's that easy place that people can go to get information about anything at the hospital, especially if they need to come to A&E. That is one of the resources. Also, you mentioned that the radio show, we are going to focus on a lot of what Dr. Forde is talking about, which is prevention better than cure. Getting people early, getting people to call the hotline, getting people to know what's happening with them, and also getting people to come and donate blood generally, because it's something that we know that we have had a move from to the annex and back to Gemmitt's Lane.
Yes.
But we're there, and we want really people to come in and do their best and give blood during this Valentine's Day, this Valentine's
And you
season as
also
well.
have another initiative for Valentine's Day, Love
Yes,
at First.
Love at First Sight. We always welcome the public into our doors for these pop-ups. So it's another one of those. We got to really thank Sophia Williams for organizing and pulling it together. A number of our internal departments joined the external vendors on the ground floor corridor. You know, we start at 9 and go straight to 5 this evening. So we ask people, you know, if you're visiting the hospital, if you're passing through, if you're a patient leaving, you know, come and see what we have to offer, you know.
Dr. Forde is laughing.
I don't know
you
why
don't
he's
believe
on
in
the
love at
corridor.
first sight?
He's
I'm
on the
not
corridor doing his
understanding.
thing with the infection control team.
I'm not understanding.
Are you remembering the suit that you had on?
Yeah.
Oh, okay. He was a mascot for one of our
You're
more
not supposed
recent
to say
pop-ups.
it's Shane.
Okay.
Oh, sorry.
But no,
my
that's
apologies.
good. That's
My
good.
apologies.
You're leading from the front. You're bringing joy. You know, you're bringing joy. So that's a great thing. So yes, go on over to the hospital for pop-ups, because it's really good to see the change in strategy. Because before, you know, we only see the hospital as a sterile kind of institution that doesn't encourage interaction and so on. But that's far from the point.
It's a learning institution.
And
it's
you
a
need
teaching
the love.
institution.
The love also heals.
Love is in the air.
Good. So I want to thank
We're trying.
Dr. Forde and Shane Seeley, for coming and joining us this morning here on Morning Barbados to discuss the QEH. Remember, their Pulse Radio show resumes on Monday on the best station, Q100.7.
Morning, morning, morning. Good morning.